The Daratumumab lenalidomide trial, this is a trials in progress abstract, and it is a intergroup trial led by SWOG, also with participation by the BMT-CTN and the Alliance Cooperative Groups. And it's trying to answer two questions. The first question being that if we add Daratumumab to lenalidomide as a maintenance therapy, can we deepen responses, prolong responses, and ultimately improve overall survival? As everyone knows, lenalidomide is the FDA-approved agent for maintenance following autologous transplant. But we also know that combining Daratumumab with lenalidomide, both in the relapse setting, as per the POLLUX trial, also in the newly diagnosed setting, as per the MAIA trial, we saw an increase in response rates and, even more importantly, a deepening of response, including to the MRD negative state, with the Dara-Len combination compared to just lenalidomide alone. So in this SWOG S1803 dramatic study, we will be looking at rates of MRD in patients treated with either Dara-Len versus Len alone as maintenance therapy following a single autologous transplant. The second thing that's very important is we're trying to answer the question, if you get a very deep response, i.e. MRD negative, is it necessary to stay on maintenance therapy? And so patients will be randomized to Dara or Len or Len alone, be maintained on that for 2 years. At 2 years, patients who are MRD negative will have a second randomization to either continuing maintenance on the arm they were assigned or to discontinuing maintenance. And again, we will then assess their duration, their progression-free survival, as well as their overall survival with this approach. So in summary, it's going to answer two questions for us. Number one, the addition of antibody therapy as a maintenance strategy. And secondly, if you get a deep response, perhaps you do not need to be continued on maintenance therapy. The other thing about this trial is that we've been trying to really represent the population in the United States and Canada that will be eligible for transplant, and that allows patients up to the age of 75 to be enrolled. We're also very excited now that the Canadian cooperative groups will also be joining us in this trial. So it's a tremendous opportunity for patients. We also will allow patients to be enrolled after their transplants, so recognizing that many patients are already at transplant centers. So as long as they haven't started maintenance therapy, they have an opportunity, even if they've already had a transplant, to participate in this trial.